talk is some basic aspects. I have no financial interest in anything what I mention in this lecture. Human eye is far more superior than any camera which is available today. So it is imperative to understand the camera to get the best photograph or the best video. Getting a good surgical video or clinical photograph is an art which can be mastered by systematic, skillful execution of certain basic photographic principles. I always say that a surgeon who has excellent videos is definitely a skilled surgeon, but vice versa is not true. A very skilled surgeon may have poor videos. Now, what I am going to discuss first is basic cameras. I think today in this era we are talking of digital cameras and not roll-based cameras. As we know, any camera would have three parts: optical system, aperture and shutter, and image pickup device. Optical system, since we are all ophthalmologists, I think I don't have to deal much into it. It suffices to say that focal length of the lens in a camera determines the magnification or zoom. More the focal length, more is the magnification, and more the object appears closer. Now, in compact cameras, we have this macro focusing mode which gives you a zoom picture. Now today we are talking either of compact cameras which are automatic, where you don't have to do anything, you just have to click the button and the picture is taken, or you have SLR cameras or single lens reflex cameras. Obviously SLR cameras give you better quality of picture because they have variable zoom, variable lenses, and compact cameras would be little inferior, but today compact cameras also have improved a lot. The basic principle of SLR camera is that when you click, a mirror comes in between you and the image sensing device, and that is how the photograph is taken very well. It's like, you have a beam splitter in a video in your microscope and you take photograph, and you don't have a beam splitter. If you don't have beam splitter, 100% light comes to you, but if you have a beam splitter, either 50-50 or 30-70 light comes. So in an SLR camera, when you click, it is 100% light going to the image sensor, and that's why photograph is much better. Aperture and shutter speed I think it's like iris and pupil. This can be adjusted. Now I think today's technology, unlike roll or film-based camera, we have image sensor in a digital camera, or in a video camera CCD, and in digital cameras we have better technology called CMOS technology. These are basically where the image is captured. Now we always talk of resolution of camera, that this camera is 5 megapixels, this camera is 10 megapixels. Higher the megapixel of a camera, higher is the quality of image. That means if you zoom that image, there won't be any granularity or loss of details. You can have in a video camera 3-chip or single chip camera. 3-chip camera are obviously better than single chip camera, because there each of the color blue, green and red is represented by different chips, so 3-chip cameras are better. I think we'll just go on now slit lamp photography, which is very useful for all, whether you are anterior segment surgeon or posterior segment surgeon, because even I am basically a retina specialist and we spoil cornea, or sometimes through hazy cornea we have to operate. So, and find rubeosis, suppose you have. If you have documented that rubeosis with your slit lamp photography, then you give Avastin or you do laser and that rubeosis disappears. It's beautiful to document. Obviously for anterior segment surgeon to document cataract and show patient that you have this cataract may be very rewarding even financially to have this slit lamp photography. Now the simplest way to have simple slit lamp photography is you have a handheld digital camera and hold it in front of one of the eyepiece. Now this is from Rajesh Fogla's article in IJO, that you can use this digital compact camera and put it in one of the eyepiece here into this. After removing this, you can put this into this binocular things tube, and you can have a good photograph. I use photo slit lamp because it's very easy and comfortable to use, but I think both systems are good. this particular, I think this system, we have people who are expert at it and are able to take good quality pictures. Only you need steady hand, and which is not difficult for an ophthalmic surgeon. This photograph is one of my friend Dr. Bhatti from Bombay. His photograph he has taken with this ordinary camera attached to the slit lamp by handheld mechanism, and you can see beautifully the PCO. Now I think this is one of the most inexpensive way, and one can use Nikon Coolpix or similar cameras and use it to take slit lamp photography. The disadvantage would be that you would not have flash unit incorporated in it. This is what I have, photo slit lamp, where this is with flash, again a good quality of picture. I was discussing with Rajesh Vokla now, since you have cameras which are 5 megapixel and 10 megapixels and the technology has improved, so even without flash in a newer camera, say for example iPhone or any digital phone, say Samsung Note or something, you would be able to take photograph because the image capturing time is less. The moment you click, the image is taken immediately. So even if you don't have flash, I think you can capture good image. This macro mode can also be used to take close-up pictures. Now I'll discuss about how to get good video. Now these are certain basic but most important points to understand for taking a good quality video. That is white balance, black balance, what is illumination you are going to use, what is the angle of field, whether you have 3-chip camera or 1-chip camera, and what microscope you are using. I am just going to take you to the basics of this. Now relatively important points are gain control, shutter speed or CCD, iris, and area of interest, hardware, software, somebody else is going to discuss. Now this is a simple beautiful photograph. This is how a person would look in a normal day, sunny daylight, and this is with another camera where white balance is not adjusted. The same picture looks bluish or that. So what is the difference between this photograph and this photograph? Here there is additional bluish tinge. So if you remove this additional bluish tinge, then white balance is adjusted for this daylight. As I told in my first slide, that human eye is so good that in varying light conditions we would appreciate white color as white color, but camera cannot appreciate that. Camera has to be taught to see that this white is like this white. So our eyes are good at judging what is white under different light conditions, and different light sources have different color temperature. So that is why the picture would appear yellowish or orange in tungsten lighting and bluish or greenish in fluorescent lighting. Daylight would be fluorescent lighting. Now what is white balance? White balance is a process of removing this unrealistic or artificial color what has been added to the picture. So the objects which appear white in person are rendered white even in photograph or movie. The microscope light, halogen light source, metal halide or xenon light source which we use in retinal surgery have different color temperatures. So you need to adjust white balance. Now I'll just show you this video which will make things clear. Now see, this is how your normal eye would appear, the conjunctival color and other things. Now the same light, same camera, without adjustment the retina appears bluish. If you see here, the retina is bluish in color because this is a halogen light, so the retina appears bluish here. Now I adjust the white balance from automatic white balance to 5600 because that is the color temperature of matter, this xenon light source, and I adjust it with a cotton which is definitely white. And without doing anything, now you can see that the retina color appears different. So this is what the importance of white balance. I don't think it would matter much for anterior segment, but for retina it would definitely matter. Another important point is to have a diffuse illumination. Here the light source is held away from the eye. Now if you see, without adjusting white balance, now the same conjunctiva appears reddish in color, and once I adjust to automatic white balance, it becomes normal color. So this is the importance of white balance, that it is very important to adjust white balance to different light sources which you use, especially for retinal surgeries. Now any photograph, you should have a high magnification and wider field of view to have better quality of picture. So when we are talking of retinal surgeries, I think biome or any wide angle lenses would be better. I usually use 90 diopter lens. A good quality microscope with a good beam splitter would be essential. 50-50 component would be better for better video quality. And area of interest is important. Now, if you have such reticle in the center of eyepiece, your area of interest would be always in the center of picture. So you have to get the picture in the center of this reticle, and it would be better. Usually I keep automatic gain control, auto exposure and CCD iris. 3-chip camera is always better. I think this is going to be covered by some other speakers. So the best may be to have Sony 3-chip camera or any such system, and I use this Pinnacle Studio. And I think what is important is that I record all surgeries from beginning to end of conjunctival closure, and we maintain it very accurately. And in between surgery, I also look at the video monitor, because sometimes you are seeing your video after the surgery and you don't know how good you have recorded. And it's important to go through your surgeries. So good microscope or a good camera, I think, is very important. Thank you for your patient hearing.